Here's another interesting dog tale. When dogs have back or spinal pain, there are doggy chiropractors who can offer some help.
A lot of times veterinarians will come to me and they'll say, well, we've got a dog and we've ruled out everything else. We don't really know why this dog is limping or why the dog seems to have pain. See if you can find something. And I'll do my work, and very often we'll see a reduction in pain and an increase in mobility. Basically what I'm going to do is inspection, there's palpation, there's feeling the muscles, feeling the joints, and then I'm going to do my evaluation and adjustments. It's very similar to what we do with people. I always start at the top, and I just get a very general sense about how the upper neck bones, and he's agreeing with me, how they feel. It's just like working with a person, except people tend to lie still and animals tend to move, so I have to move with them. And you notice that we'll come to certain points where when we push down, you'll see these reactions. And when we do our adjustments, we look to see if we can reduce those reflexes, if we can calm things down. So I'm going to feel down his spine. You can see that this is an area of reactivity. I'm going to keep a note of that because when I go to adjust him, I want to see how that reacts as well. Great Danes make very good patients. They tend to be very passive. They love being worked on. Okay. Now I'm going to start my adjustments with them. And before I adjust, I always introduce the instrument to them. They can sniff it. And I just click it because it makes a clicking sound. It's a very light force. Some people will say, well, is that enough to make an adjustment work? And I say, yes, it is. And I always say, hold out your hand, and I'll impulse into their hand, and they'll think, well, that's very light. It doesn't take much to make a reaction, and it doesn't take much to do a reset of a joint. That's why I like working with this. So I'm going to start at the very top, and basically I'm impulsing on those joints of the spine to see if I am going to get a reaction. And so far he seems to be doing pretty well. He's got good springiness in these joints. I'm going to move down. There. Right there. We have a segment that's under a bit of a tension, so you notice if I push this way, he seems to react a lot more. If I push this way, he doesn't. So there is some rotation in that spine. As I do this, hopefully what we'll see are these subluxations reduced and the tension turned down. We judge animals often on how well they move. So our basis for successful treatment is often improvement in movement, and that's what we see a lot with chiropractic.
If you're unsure if your canine needs help from a chiropractor, it's best to talk with your local vet to get his advice.